KwaZulu-Natal Premier Sihle Zikalala says they're happy with the 60% COVID-19 recovery rate recorded in the province. KwaZulu-Natal's recovery rate is above the national average, which is currently at 42%. Zikalala says the province is now finalising plans for the peak of infections, which is expected to occur later this year. He joins us now. A very good evening to you, Premier. Thank you so much for speaking to us. Before we talk about the figures, there was an incident that came to light earlier on. The Moe Mbofana local municipality mayor recorded in a video that's circulating of himself giving out statistics. Now, we know this is illegal according to the Health Department, or rather the National Disaster Act Management Act, saying that the Health Department must announce the figures. So what has been your reaction to this? How did it come to this?
No, thanks. Firstly, we will want to make it clear, SABC, so that the National Command Council, especially the minister, are the one mandated to issue and announce cases as and when those cases are confirmed through the processes. Now, it is uncalled for and it is wrong for any councillor to go around announcing or presenting any statistics, especially when it will confirm cases. And that's why we have criticized the mayor, but we also call on him to withdraw that and apologize because it is wrong.
Okay, I want to go to the statistics that we have thus far, as we put there on the screen: 1,498, 45 deaths. Those were the last figures that we had. Is this still accurate, or have the figures changed?
Yes, these are figures that reflect the state of affairs as of yesterday. And we are happy with this. It will be remembered that KwaZulu-Natal was the first to report a case. Patient 0 was found here in KwaZulu-Natal. And subsequent to that, we faced a serious challenge with the escalation of numbers, which was a reflection of the spread. But also it then led to fatalities where deaths will be reported each and every day. We are happy with progress, though we know that we have not reached the end, we have not succeeded. We still need to fight and win this battle. But the fact that there are days now that pass without any death being reported is helping and it is inspiring us. And the fact that we've got more than 60% recoveries, it tells you that we can win this process.
What do you attribute that to? Because you're also still voicing concerns around areas such as eThekwini, which is where most of your deaths are from. Ilembe and Ngungundlovu are some of the areas that you're concerned about. Just look at the balance. How are you able to improve the figures, the recovery rate, but yet you still have these hotspots?
Recovery rate is improving because we have been able to convince people. Once we found that a person is infected, we will then engage that person in a correct way. Just engage, convince that person to go for quarantining. And quarantine as well as self-isolation are very helpful because the time you are a contact, you go to quarantine. But if it is confirmed that you do have a COVID-19, you will then go to self-isolation, get treated. Now, what is proven here is that we can ensure that our people recover from COVID-19. It is important that they stay aside on their own, focus on treatment, then we are going to see more of people recovering.
Premier, you have a 1.1% hospital occupancy rate, which is pretty much average in terms of what we're seeing across the country, but we are seeing growing cases in the townships. We've heard that that is a powder keg. Especially across the country, we have been consistently worried about these high-density areas. How are you going to employ the same methods in the townships as in to convince people to not only social distance, but to at least go and get themselves checked out if the screening and the tests are not being run in their areas?
We can confirm that we have embarked on a mass screening and testing program, especially in areas like eThekwini, where there is a high rate of infection. We are testing all people within this district of eThekwini, and that will be the same with KwaDukuza, in particular under Ilem. We want to screen and ensure that the screening take place, but also ensure that those who are who are supposed to test, and then they are, if they are confirmed to be positive, attended to with speed. So mass screening is the program that is going to help us in townships.
Now, there's an issue of rural areas. We're not seeing as high increases of COVID-19 positive cases. Why do you think that is?
Well, firstly, I think the lockdown helped us. We must commend the president, the ministers for a decision they've taken, because the lockdown helped us. It helped us to manage and be able to track where the disease was and the infections were taking place. And there were no movement of people from one district to the other. Now we must begin to be ready for that, because once we lift the lockdown, we must again have a mitigating strategy to prevent the people who are in cities going to rural areas, and where you will have then infection.
Okay.
So we are working on that plan.
Premier, just a final question. You have said you're working on level 3, but you've also warned that people must adhere to the non-pharmaceutical interventions, precautionary measures. If people don't, does that mean the province won't descend to level 3?
Well, we will deal with case by case. And for those who do not follow the rules and the regulations, we will have to deal with them on their own. But with regard to the business community, we are working with them, and they are prepared to follow all directives, including social distancing, provision of masks, provision of sanitizers, and all that is prescribed.
All right, thank you so much for speaking to us. KwaZulu-Natal Premier Sihle Zikalala saying they're hugely encouraged by more than 60% recovery rate that they're seeing in KwaZulu-Natal, but they're still very concerned, especially in the townships of township areas in eThekwini, as well as KwaDukuza, that they are ramping up testing and screening there, and also ensuring that businesses are ready for level 3. Now,